All right, last time I had said we were going to talk about dividing healthcare. That's going to be the next one. We're going to talk a little bit about euthanasia and physician-assisted suicide today. All right, so in euthanasia and physician-assisted suicide, the bioethical heart of the matter is the moral rightness of killing or letting die for the good of the patient. I'm sure you're all aware of this. There are times when extraordinary means to keep someone alive is considered to be non-viable, and we step back from any type of treatment that's going to prolong life because the individual is terminal, and to alleviate any undue pain for that particular period of time. Doctors and nurses have sworn to preserve life and relieve suffering, but how do we do this when the only way to end suffering is to end life? So obviously, when we look at the Hippocratic Oath, the medical practitioner is obligated to preserve life. But they're also obligated to relieve suffering. Sometimes these two obligations are at odds. Sometimes these are conflicting. Sometimes, in order to preserve life, you're actually going to put someone through undue suffering. Sometimes, in order to end someone's suffering or stop suffering, you have to not preserve the life of the individual. This is where you have a conflict between the two things. More often than most other issues in bioethics, the morality of euthanasia and physician-assisted suicide is tangled with legal and policy debates. So obviously, and you can understand why, people, and particularly people in the medical field, are afraid of being sued. And not just sued, but being presented with criminal charges if they are actually not going above and beyond what is necessary to keep someone alive and keep them healthy. You are not necessarily guilty of inconsistency if you think some instances of physician-assisted suicide are morally permissible, but believe the practice should never be legalized because legalization might lead to abuse. So what this means is that when we talk about physician-assisted suicide, what are we talking about? Are we talking about ending someone's life? Are we talking about withholding care so that the person just dies naturally? Obviously, the latter is the most common form of what we would call euthanasia, even though typically people don't see it as euthanasia. They see it as just simply letting nature take its course, right? The case of Terri Schiavo. I don't know if any of you have heard of Terri Schiavo, but in 1990, when she was 26, Schiavo's heart stopped suddenly for reasons that are still unclear. Because of this, she suffered severe brain damage, right? She was on a feeding tube and was unconscious. Her husband was her legal guardian. He wanted to remove her feeding tube per what he had said was her wishes. She had told him in a conversation, I guess in some informal conversation, that if she was in a situation where she was on a feeding tube, she would wish to be taken off the feeding tube. However, her parents disagreed. A legal battle ensued, and her feeding tube was finally removed in 2005. 13 days later, she died. So we're talking about this individual from 1990 in the early 90s all the way to 2005. So that's what, 15 years. So you had an individual on a feeding tube for 15 years going through a legal battle with her husband, who was wanting to take her off of it, and the family of Terri Schiavo wanting her to stay on that. So as you can see, euthanasia is a very contentious topic, and it's one that can involve legal battles like this one. So what do you guys think? Should her feeding tube have been maintained or taken away? Was it dignified? Was it a dignified way to die, or painful? What do you think? Taking away someone's feeding tube and letting them die from the starvation, is that a dignified way to die? Was this the right decision? Or should she have been kept on the feeding tube? Or maybe she should have been given a lethal dose of some sort of sedative. Was that the appropriate way? Is that even a legal thing to do? Can we even do that? So these are questions that you have to ask yourself when you're looking at these type of situations. And you will, many of you will probably be in situations where something like this may occur. Deciding life and death. Euthanasia comes from the Greek word good death. It's kind of strange, isn't it? call it a good death, but it's basically taking the element of suffering out of someone's death. Death is often seen as the ultimate evil, but some see it as a blessing if it spares one from suffering. And I think most of us would agree that prolonged suffering is sometimes much worse than death in many cases. So we have two types of euthanasia. The first is active euthanasia. And this is performing an action that directly causes someone to die. It's a lethal injection. This is what we were talking about with the Terry Schiavo issue. Now, if somebody or one of the doctors had administered a lethal injection, lethal dose of some medication to actually kill Terry Schiavo, this would have been active. There are places in the world where active euthanasia is legal under very, very strict circumstances and guidelines. But it's very rare, and you're not going to see active euthanasia very much. This is very, very rare and very, very dicey in terms of its legality. Now, the second one is the much more common form of euthanasia. This is allowing someone to die by not doing something. So if someone is dying of some terminal disease and there's not any way of curing that disease, and the person is just their suffering is being prolonged, oftentimes what we'll see is the medical practitioner will have a conference and a consultancy with the loved ones of the individual, and they will talk about possibly removing what we would call extraordinary means of keeping the person alive. Of course, with pain medication and this and that. But ultimately, it's just allowing someone to die. Do you think that both are okay, or one is okay, or neither? So, you can write this, and I think we have a discussion board about this. What do you think? Do you think that active euthanasia is okay in some situations where you can actively give someone a lethal dose of a medication to take, to kill them or take them out of something? Or do you think it's only good, or it's only appropriate for passive? Or do you think neither is appropriate? Do you think that neither can be justified morally? As to the two types, the 1973 policy by the American Medical Association is this: the intentional termination of the life of one human being by another. Mercy killing is contrary to that for which the medical profession stands, and is contrary to the policy of the AMA. So as of 1973, the AMA's official position is that active euthanasia is wrong. The cessation of the employment of extraordinary means, however, means to prolong the life of the body when there is irrefutable evidence that the biological death is imminent, is the decision of the patient and or immediate family. This would be passive. So in situations where there's an extraordinary means of keeping the person alive, that's being employed to prolong the life, the refusal or the withdrawal of that particular employment of extraordinary means is appropriate in some cases under the careful and close supervision of the patient and the immediate family. Voluntary euthanasia refers to a situation in which competent patients voluntarily request or agree to euthanasia, communicating their wishes either while competent or through instructions to be followed if they become competent, if they fall back into the vegetative state. So there might be legal directives that an individual might put into writing that states, if I'm in a situation like this, I do wish that those extraordinary means or measures are taken away. Take me off the machine, pull the plug, if that is the case. So these directives that someone explicitly states prior to being in that state or in that vegetative state is where we would look at the voluntary passive euthanasia. Non-voluntary euthanasia is performed when patients are not competent to choose death for themselves. In these instances, the patient's family, physician, or other officially designated persons decide for the patient. So if there's an individual that has not given their directives of what to be done to them in those situations, which would be the voluntary euthanasia, this is non-voluntary. This is an individual that's in a state that they can't make a decision for themselves. And so that decision's made by the family, physician, or other officially designated persons that decide for the patient. Involuntary euthanasia, bringing about someone's death against his or her will or without asking for their consent while they're competent. This is obviously illegal and immoral. So involuntary active euthanasia would be wrong. Passive, though, obviously would be appropriate under certain circumstances. So 4 kinds of euthanasia. You have active voluntary euthanasia, directly causing death with consent of the patient. So the patient is having a relationship with a doctor or with a family member and says, I want to be euthanized. I'm in pain, I'm whatever, and I want you to give me a lethal dose of something. That's active. Active non-voluntary would be directly causing the death without consent of the patient. So someone's in a vegetative state, they're demonstrating pain and suffering, but they can't tell the doctor that they want to be euthanized. So the person gives them a lethal dose of something to take their life. That would be active non-voluntary. Passive voluntary, withholding, withdrawing life-sustaining measure with the consent of the patient. So passive voluntary would be a situation where the person voluntarily says, look, I want to be taken off the machine. You can pull the plug, whatever. Passive non-voluntary is where the individual's in vegetative state. They've not explicitly stated what their directives are if they were in a situation like that. So that decision has to be made by someone else that's non-voluntary, even though many people might say, well, they would want that if they were in that situation. Okay, we won't talk about that. Okay, and that pretty much does it for euthanasia. If you guys have any questions, feel free to to email me, and you can discuss it in the discussion boards or amongst yourselves about this. I think it's a great topic, and now the next lecture we'll talk a little bit about dividing up healthcare resources. So I'll see you then.